As we have been reporting, a 1-month-old infant is hospitalized with a suspected case of Powassan virus. The tick-borne disease is very rare but often deadly. Her parents now believe she was bitten last month on Martha's Vineyard. Joining us now, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Dr. Ellerin, thanks for joining us.
Good to be with you.
All right, Dr. Ellerin, her parents say their daughter's first symptom was a fever. Is that typical?
You know, Ben, that is typical. Now, this viral infection is anything but typical. As you know, it's rare, but it often starts with fevers and then goes on to headaches, which of course in a baby you wouldn't know. And then oftentimes confusion, mental status changes. Again, in an infant, that can be tricky. And then it can sometimes lead to seizures and things that need intensive care that type of care.
Yeah, so it's really scary. Is there anything doctors can do to treat it?
So, Erica, there's no specific treatments. There's no specific antivirals for Powassan. I'll give you an example. There's another type of encephalitis or brain infection called herpes or HSV. We have an antiviral called acyclovir. We don't have that same type of therapy, which I think is another reason that can make this such a serious viral infection. The other point is we don't have vaccines, so it's difficult to prevent. And it can be especially difficult to prevent in infants because the way you prevent this is to prevent the tick bite. So in adults or younger children, you can put DEET or other types of mosquito or tick repellent on. In a baby that's, not even a month old, you can't do that. So you want to think about things like mosquito type nettings or screens to cover, the stroller, for example.
Well, that's the thing. You wouldn't expect a baby in a stroller would come in contact with a tick. So that's frightening in and of itself.
No, you wouldn't.
Now,
You're right.
This is pretty rare. But I have to tell you, in the last 21 years, since 2004, there have been 74 cases total in Massachusetts. So about 3 or 4 a year. We've had 3 this year already, and we're only at the beginning of August. Do you think this is becoming more common?
It absolutely is rare, and yes, it is becoming more common. In the past 20 years, there were about 400 cases across the country. 50% of those have occurred in the past 5 years. So you're right on about that this is increasing, unfortunately, though it's still rare. Why is it rare? One of the reasons is because when you look at that deer tick that can carry this, only about 1 to 2% of deer ticks are infected with that. When you compare it to Lyme disease, some estimates say that about 1/3 of Lyme disease deer ticks carry Lyme disease. One other thing I want to say is most people who are infected with Powassan still don't get any symptoms, but the ones that do, unfortunately, can be very severe.
Wow. All right, Dr. Ellerin, thank you. Really want to check yourself
all the time.
All the time as soon as you're in from the outdoors. Thanks, Dr. T.
Thank you.
Take care.